The Black American United Memory and Aging Project is a study funded by the National Institutes of Health that seeks to better understand memory, aging, and brain health in Black American communities. Historically, Black Americans have been underrepresented in aging and Alzheimer's research, and this lack of representation has created serious gaps in diagnosing the disease, effectively treating it, and to providing support to those who have the disease. The goal of the study is to simply change that. By partnering directly with Black communities, we aim to better understand how aging and memory changes over time, identify factors that influence brain health, and ultimately improve prevention and brain health outcomes for future generations.
Research is really important to me because I grew up in Macon, Georgia, and I saw both of my grandfathers die before the age of 65. So that essentially says they died before they ever received a Social Security check, a system by which they paid in their entire life. And I dedicated my career to trying to improve the health and well-being of African Americans with the last decade or so, but focus on African American men.
The study will help us to answer questions like, why are Black Americans at a higher risk for Alzheimer's and related conditions? How can we detect changes in memory earlier? And what are the social, cultural, and biological factors that matter most when it comes to brain health in the Black community? Ultimately, our goal is to use this information to create better tools, resources, and policies that serve Black Americans.
So the BA-UMAP study is extremely important to the Black community. We need to understand why individuals in the Black community suffer from Alzheimer's disease a lot more so than those individuals in the Caucasian race. Another big reason for it is that a lot of the research that has been done to date has been done on Caucasians. Essentially, what we need to figure out is that are these treatments which are being developed going to be as equally efficient in the Black community as they are in the Caucasian community?
When I discovered this particular study, that was a no-brainer. I wanted to enroll in that study because this dreadful disease, Alzheimer's, it needs to go away. But it cannot go away if there are not research study participants. So I wanted to be a part of that, to be a part of this study, and to also encourage others to enroll in this study.
I am of the age that dementia, Alzheimer's, can occur. I have family members who are deceased because of dementia and Alzheimer's. So I was very interested in learning more and participating in research to assure where my status is related to my brain health. So when the opportunity came for me to participate in a research study on brain health, I enlisted.
The challenges for recruiting Black men is largely stem from medical mistrust and the horrific incidents that happened at with the study at the United States Public Health Service study at Tuskegee, where we found that Black men were mistreated, and 40 years later they were forgiven of the mistreatment by the federal government. And a lot of it is that Black men don't have the awareness of research. And then when they do have the awareness of research, it's just this huge issue of not necessarily knowing and being able to build a relationship. I think what we do different in our study in BA-UMAP is that we're out in the community, we're building a relationship with them as opposed to directly going in and asking them immediately to join a study.
There's no cure. Unfortunately, there's no cure for Alzheimer's disease, and the numbers are only growing. Alzheimer's not only robs people of their lives, it also impacts the family, particularly the family caregiver. And the research project will enable us, as well as society, to learn more about protective factors. Why do some people not develop Alzheimer's disease? And then the lifestyle, why do some people develop it? So we need as many people to participate as possible to help us discover, how do we protect ourselves? What are we doing right? And then what are those risk factors? What do we need to stop doing?
Joining is easy, and everything can be done from the comfort of your home. You'll complete a few short memory games on your phone or computer, fill out a survey, and if you choose, receive a kit to provide a saliva or urine sample. That's it. You will be compensated for your time, and everything is confidential, and all information is de-identified, so no one will know what data belongs to you. If you're ready to be seen, if you're ready to be heard and counted, visit secure.BA-UMAP.com to get started. Again, that's secure.BA-UMAP.com.